Hi, my name is David Burke at Alliance Counseling Group, and today we are here with Michaela. And Michaela, I was hoping that you could introduce yourself and give some of your credentials before we begin.
Yeah, hi, I'm Michaela Ayew-ew. I'm a licensed professional counselor and certified perinatal mental health specialist.
Well, I need to know more about the perinatal mental health specialist. That sounds really interesting. Well, our task today is I want to hear a little bit about the kind of work that you do, the kind of client you like to talk to, and when the door closes and it's just you and a client, I want to hear a little bit about what that's like.
Yeah, I primarily support clients as they navigate through fertility challenges, birth trauma, postpartum struggles, and parenting concerns. Some seasons of life can feel especially challenging. Motherhood, in particular, can feel really scary, overwhelming, and even isolating at times. People don't always feel comfortable talking to their friends or family members about their struggles. So that's where I come in. I hold space for my clients to process difficult life experiences and to celebrate their successes. I affirm the inner strengths of my clients and support them as they work towards developing a new sense of peace and healing.
Wow. So, in thinking about that client in that season of life, what sort of training did you get into to really to show up as the professional to serve the client there?
I have gone through an extensive amount of training outside of graduate school. Um, I was certified through Postpartum Support International, and they really focus on women throughout the life cycle from trying to get pregnant and struggling to get pregnant, what it looks like to be pregnant, and walking through those various challenges of pregnancy. Postpartum obviously comes with a whole set of struggles and adjusting to new routines. And then also the hardships associated with kids as they get older, really supporting them through different stages of development. And so the trainings have really been focused on that.
That sounds like such a hard season to be in with a client. That must be some deep waters to be walking through with them.
Yeah, every client comes into therapy with different struggles and different things that just feel really overwhelming and hard. Motherhood can feel really isolating, and I think it's hard when clients aren't able to be open and vulnerable with people in their lives because they're afraid of what they may think. They're afraid of judgments. They're afraid that people may think that they're not a good mom or they should be doing something different. And I think it's really important just to honor and respect each stage of parenting for what it is and to just meet my clients where they're at, to talk about the things that are hard and also to really get excited about the things that are good and to experience those moments where client really feels like, yeah, today I did really well, to celebrate those, but also to hold space and sit with the days that it feels like they didn't meet their own expectation.
And so, who is the client that you get really excited about making that space for them? That when they are working on that sort of particular issue and that demographic, who's that person that you can get really excited about?
The client that wants to show up, the client that wants to really learn how to grow as a mom, as a human, as a partner, as a working professional, whatever roles they may have, the type of person that just wants to show up, to be their best selves, and to really learn how to thrive in this crazy thing called life.
I wonder how much, when you're talking about that struggle with mothering, is it okay to say it like that? I guess for starters, is that to use
Yeah.
that when you're talking about someone struggling through that space? So often we think of mental health counseling that it's sort of a in your head or in your heart. I wonder how much do you talk about physical things, physical symptoms, being with your client's body because of how much is happening for someone in that season.
Yeah, absolutely. Especially during pregnancy, there's so much that's happening in your body, and you don't always understand what's happening. And so clients will often ask me, hey, I notice that this is happening and it's causing me anxiety. What should I do? And so we work on, what we can in therapy, right? And sometimes there's also collaboration with OBs or other medical providers in addition to that. But yeah, I mean, we talk about pregnancy symptoms and, the joys of postpartum and what that looks like and how bodies are changing because pregnancy, postpartum, it all impacts you in different ways. And every client has that experience felt differently in their lives.
Can you hear a little bit more about the collaboration piece? That's something that we really emphasize at Alliance, to be a persistent care collaborator. But that feels like that feels like there's more to that. There's more you're paying attention to. So can you think of an example or story where you've do a lot of collaborating with people outside of the counseling?
Yeah, absolutely. So I work alongside OBs at times where a client is really struggling with their mental health in the context of pregnancy and postpartum. It's not uncommon for me to speak with OBs to talk about what I'm noticing mental health wise with them. So as they are thinking about medication, they can make a decision about that side of things. And so we work in tandem, especially if clients are really struggling with more severe symptoms, either during pregnancy or postpartum. I also occasionally will work with psychiatrists, psychiatric PAs, just to coordinate care to make sure that nothing's being missed. They're seeing things that I'm not seeing, I'm seeing things that they're not seeing, just to ensure that clients are getting the treatment that they need on both ends of things. I also sometimes collaborate with marriage therapists because especially in the young child rearing periods of time, marriages can feel different. And so there are times where a client of mine will be also seeking marriage couples therapy. And so I will collaborate with those therapists as well.
So many different applications. So recently I heard somebody ask, what do you think your client would say it's like to sit across from you? What are some of the qualities that they see in you that they really like? So can I give you that question and put you on the spot to say, what do you hear from clients, or what do clients say they think it's like to sit across from you?
Yeah, absolutely. I believe therapy works best when the client and therapist both show up as their authentic selves. Clients coming to therapy, they're ready to do that. And I think that's a really important part of therapy, is for the therapist to do the same. And so I, share bits and pieces of my experience in motherhood. I validate because I, at some point, have probably felt anxious about, whether or not my baby's sleeping enough, or, any number of things that may come up in motherhood, challenges with feeding, or challenges with sleeping, or just taking care of this new human. And so to just be able to say, yeah, I get it. That was really hard. All moms have been in a space at some point where they've struggled. And so just to be able to validate from a space of, I've been there, I'm also a mom, and it's hard.
Yes. And you see a lot of your clients virtually using the telehealth platform. What do you say to people that may be a little reluctant to step into that space? For your clientele, what makes a virtual visit a good one?
Yeah, so most of my clients really enjoy the flexibility of telehealth because it allows them to meet with me at a time and in a place that's really convenient for them. I enjoy working with clients via telehealth because it really allows me to step into their space virtually. I often meet with clients from the comfort of their home while they're sitting in their car or while they're tucked away in a quiet room in their office. Seeing clients in their environment really gives me a unique look into their everyday experience, and it allows them to feel fully comfortable with that experience too. Some moms have anxieties about being away from their babies. And so sometimes that looks like them bringing their babies into session with them, or bringing their toddlers into session. Sometimes it looks like they're a room away and they know that they're close by if they do need to step away momentarily, just to make sure that everything's okay.
Yeah, so maybe sometimes your sessions get interrupted with a wee one giving some tears.
Yeah, sometimes, and that's totally okay. I embrace the chaos of that. I think it's really a unique experience to be able to see moms with their children interacting. It gives me a better idea of what the relationship dynamics are like, what their struggles may be. And so I really think that it's a really unique opportunity to just be able to support them truly where they're at in life.
It's funny because I think a lot of counselors would say, I want to meet the client where they're at. I think I say that at times, but that might be, when you say it, that might be taking it to a new level. That, I'll meet you where you're at with your baby, with the diaper, where it is. And look, is chaos the right word?
Yeah, absolutely. I think sometimes motherhood can be a little chaotic, right? It can be hectic. It can be, fast moving. Sometimes I hear from moms, I don't really get an opportunity to sit down. I don't get quiet time. And so I think being able to sit with them in that space of sometimes a baby starts napping and they wake up, and that's okay. And we just roll with it. And I get to smile at babies and make faces with them while I talk to their mom about what's hard and what's challenging in this season.
And all of that's close.
Yeah, absolutely. I think moms just need to be seen. They need to be able to have a space where they can talk about the hard and they can feel understood and supported. I don't think that there's any doubt that there's not enough support for moms. There are childcare barriers. There are struggles with either going back to work or not going back to work and stepping into a role of being a stay-at-home mom. And there's so many new, unique challenges as kids develop. And so to be able to do therapy while the mom is also going through her life, it's just invaluable.
So I sort of say this with a little bit of a smile. Meeting a client dealing with pregnancy issues and then having a little baby and the back to work transition and then toddler issues. Do you have clients for a lifetime? What does transformation look like? Like that they start with you and then work to higher well-being. What's that look like?
Yeah, I do generally see clients for longer term. I sometimes will work with women struggling with infertility. They get pregnant. I see them throughout their pregnancy. They have their baby. I see them through that postpartum time. And then, they're starting to feel more like themselves, more confident in their new role as mom, but then they start thinking about having another baby. And so it's not uncommon for me then to see them through another pregnancy and postpartum experience. A lot of my clients want to work with a therapist for more long term so that they have that continuity of care over the course of their childbearing years.
Love it. You do such important work, and I love that you have carved out this niche, this concern for this demographic, and that you've trained yourself in these different ways, including we didn't even talk about OCD.
Yeah.
You want to say anything about that?
Sure. Yeah. So initially, I kind of started, my specializations in this, pregnancy, postpartum demographic. And as I continued on with the work, I noticed a significant number of clients had postpartum OCD. There are many different mood and anxiety disorders within the postpartum realm, and OCD is one of them. It's really common, it's really misunderstood, and so I sought additional training in OCD treatment as well to work with moms that were struggling with the postpartum OCD.
Love it. I love your passion to be equipped to meet these moms where they're at and care for them for not today, but for all what they might need. Thank you for being part of Alliance and for taking this time to talk with me. I really appreciate that.
Yeah, absolutely.
All right. Well, have a nice day.